I'm Mayur U Shetty. I'm CEO at BlackFrog Technologies. We are a medical refrigeration company. Emvólio is the world's first product pre-qualified by WHO as an active cooled vaccine carrier. Emvólio is a battery-powered system that's going to point of administering of vaccine. Our flagship product is called Emvólio. Emvólio is a portable battery-powered medical refrigeration system. This is a backpack-mounted solution meant to carry vaccines and other thermally sensitive biologicals to very rural and inaccessible areas. We use independent loggers. So with traditional systems, we know they're non-compliant, but how non-compliant and where are these systems going with the non-compliant system? We put wireless temperature sensors inside the current ice-based system wherever they're going, and we do the same thing, and then we contrast it, saying that there was 3-4 hours of freezing with the ice-based carrier, which implies that there's a very high likelihood that the vaccines have lost the potency, and we've still administered them anyway. Whereas with our system, there is no freezing, there is no temperature exertion, which means it's safe. We carry about 200,000 doses of vaccines in rural and hard-to-reach areas. We work in the deserts of Rajasthan, in the coast and plains of Karnataka and Tamil Nadu as well. This is something we're scaling across Africa now. Our focus is the global south. Through Aarohan Award and the fund support that we got from the award itself, we were able to conduct multiple refresher trainings. We were able to drive that point across, and we've seen a clear uptake in the adoption. We have to bring the cost down, we have to make it more durable, rugged, and kind of optimize it for everyday use, and that requires constant investment. And I think the Aarohan Award was quite crucial in that regard, because a lot of big names, a lot of very interesting and important people who've been part of the event and the program itself. So we were able to kind of leverage that to drive in more funds. The funding we received from the award itself was definitely able to have a tangible impact or increase the uptake itself. As I mentioned, we were able to conduct trainings, follow-on trainings, refresher trainings to ensure that there has been an uptake, and we've noticed it. We've received more letters of intent stating there is a request for more number of Emvólio units after the refresher training. So there's definitely been a tangible impact from the funding aspect as well, apart from the name and just the reputation that Aarohan comes with. Aarohan Awards it's probably one of the biggest events in the country where you are funding non-profits and you are funding social innovation, and technology in that directly benefits society get promoted. And I think Aarohan is doing a fantastic job. Public health is free in India. Almost all of the routine vaccines are provided free of cost, and that's a great effort. And that also means we don't get a say in the way that it's carried. So in the public health space, while the vaccines are great, of course, they're tested, their efficacy is demonstrated, they're approved by both Government of India as well as WHO as well. But the way that they're carried also comes to the field staff, the health workers who carry them. And even in the presence of newer technologies and newer intervention, it also finally comes down to the human side of operation, where you have that inertia and change is difficult. Our focus has always been maternal and child health, transporting vaccines to pregnant women and newborn infants. So we began our work in 2017, transporting routine vaccines like polio, BCG, MMR vaccines. It's been highlighted since COVID-19. How do we prevent the next pandemic, or at least how do we prevent the next epidemic from becoming a global pandemic? And that's also context from other smaller diseases like dengue, malaria. Just last year, after over 20-30 years of research, we finally have a vaccine for both dengue and malaria. It's imperative that they're carried in the appropriate way. With global temperatures rising today, it's on one end, it's increasing the number of communicable diseases, but also it's making it harder to carry these thermosensitive vaccines to remote areas without compromising on the integrity. The challenge is on the logistical end. Once the vaccines are ready, you have to get it in the appropriate way, where the temperature is maintained, the potency is maintained up until it is administered to the end recipient. The way that they're carried also comes to the field staff, the health workers who carry them. And even in the presence of newer technologies and newer intervention, it also finally comes down to the human side of operation, where you have that inertia and change is difficult. So I think that's the primary challenge here. The proof of the pudding is in ensuring that the vaccine actually creates that immunogenicity in the end recipient. And I think that's where our work becomes relevant. We've had the luxury of choosing the investors who have had this as part of their focus. Social impact has been their focus. We've been backed by funders where they look at it as patient capital, where social impact and societal good kind of trumps any return on investment in the shorter term. Aarohan was one of the biggest names in the country, right? And the award and the exposure that got us was substantial. I mean, we were able to bring in more investment into our space. We were able to scale our technology, and technology has to constantly evolve. When you move from low tech to high tech, there is always going to be inertia where end users are like, is this really necessary? The award, and since then, we've been able to kind of mitigate those concerns, get that awareness across, show data, and demonstrate it to the end users that there is a real need to shift away from traditional systems to bring more accountability and truly create that social impact. It's part of my job to kind of tweaking the product and ensuring that there's more value for money, right? And something that we realized with the adoption is that part of the refresher trainings and just speaking to ASHA workers and Anganwadi workers, we realized there's a lot of other things that they are in task with, like collecting patient information, vaccine vial information. That's something that we are now kind of incorporating into Emvólio. We have this unique privilege of incorporating other existing technology like NFC scanners, barcode scanners on Emvólio itself, so that you can read data from the vaccine vials. Vaccine vial traceability is quite poor today, right from the point that it's manufactured up until it's administered. Right? That's something that's very critical in healthcare as well. That traceability needs to be there, and we're trying to bring that now where while each vaccines are being administered, you can scan the vaccines, you can correspond it against individual vaccine recipient. These are cards with data on what vaccines you are due and what vaccines you are already administered. So now we want to correlate that against vaccine vials. Again, because we are a battery powered system, there's a lot of potential to capture more data. First and the easiest way that we measure this is the number of incremental doses that you've been able to administer with our intervention. With an electronic system, the battery life is much longer, that you're able to go on for a couple of days, but also we provide this portable solar panel so that if you go to rural and remote facilities, you're able to plug it in and keep it running continuously. We have the vaccines, we have the resources, the vaccines are potent, they work. The challenge is we are not able to reach zero-dose children on that day one of the campaign. Now with our intervention, we are able to take it to day 2, day 3. The number of campaign days are increasing, which means your chances of reaching zero-dose children is much higher, which means the number of infants you are targeting, that's also much higher. So the number of doses you are administering is much higher. So that's a direct measure of the impact of our intervention. As a social innovator, it's a huge brand to be associated with. Definitely has helped us with follow-on funding and seek investment. It's a good brand association for us to be a part of, both Aarohan and Infosys Foundation at large. New engineers and new inventors to kind of get something that works and get it out in the field so that you learn as many things as possible. It's crucial to get feedback from as many people as possible, as many perspectives as possible. So, and Aarohan especially brings together some of the sharpest minds in the country.